Welcome everyone to today's webinar. I am Emma Goodman with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have by typing them into your control panel in the space labeled "Enter a question for staff" and clicking send. We are looking forward to hearing your questions. Additionally, in about a week following the webinar, we will be sending you a copy of the presentation to the email you used to register. At this time, it is now my pleasure to start today's webinar by introducing our moderator, Brian Warren. Brian is the Director of Healthcare Solutions for Select International. And Brian, I'll now turn the floor over to you.
Thanks, Emma, and good afternoon, everyone. Select International is, as always, excited to be sponsoring today's webinar with Becker's Hospital Review. As Emma mentioned, I'm Brian Warren, the Director of Healthcare Solutions for Select International, and I have the pleasure of moderating today's panel discussion. In a minute, I'll introduce the panel members, and then we'll get started. We'll discuss what we mean by the term evidence-based hiring, including how each of the panelists look at it, and particularly how Kurt and Tanya are implementing these concepts at their respective organizations. We'll talk about some of the positive impact they are seeing, and then we'll have an open discussion incorporating your questions so we can really explore the practical considerations in building a more effective hiring system, particularly exploring what works well, where you'll face challenges, and how these concepts need to be adapted to your unique situation, especially for those of you in healthcare, as we're all facing some unique challenges, and implementing these strategies requires a somewhat unique approach in some areas. As Emma said, we want to answer your questions, so feel free to submit them throughout the discussion. We'll talk for probably 30 minutes, but we'll save the latter half of this hour for discussion. We'll incorporate your questions at the end, certainly, but there may be situations where the question warrants attention throughout the presentation. So again, feel free to submit your thoughts in questions. With that, let me introduce the panel. Lori Wasco is the Manager of Healthcare Consulting at Select International. She's an industrial organizational psychologist and leads a team of consultants working with some of the top healthcare systems in the country. They serve as trusted advisors in the area of behavioral competencies, performance, hiring strategies, from frontline staff through executives. Lori has particular expertise in psychometric testing design, selection system design, validation, and legal defensibility. And before we stole her for the healthcare team, she worked in a number of industries, including some pretty sophisticated work in the defense industry. Kurt Stillwagon is the Director and Talent Acquisition at Lancaster General Health in Lancaster, Pennsylvania. And we've had the pleasure of working with Kurt for a number of years, both at Lancaster General and before that in a similar capacity at the University of Pittsburgh Medical Center. Kurt and his team have always taken a very diligent and thoughtful approach to attracting, selecting, and retaining talent, and we're happy to have him with us today. And Tanya Kiltz is the Manager of Employee Development for Health East Care System in the Minneapolis area. Tanya has a really interesting background with broad experience, having worked in operations, HR, and learning and development. And she and her team really focus on making sure employees feel supported by the right tools and resources so that they can remain devoted to patients and experience the joy in what they do. And we've enjoyed the passion of Tanya and her team as they've built their hiring system, which is really designed to support the organization's mission. What I want to do next is let Kurt and Tanya actually give you a little bit of background on their organization and their path towards a more evidence-based approach to hiring. Kurt?
Thanks, Brian. I appreciate being here to talk a little bit about the experience that we've had. A little bit about LGH. We were recently joined to the University of Pennsylvania Health System. We've been members with that group since August of 2015. We're a pretty large health system, 663 beds, as you can see. We're actually adding on right now. We're in partnership to open a behavioral health hospital currently. And we're also 4-time designated as a magnet hospital. So to talk a little bit more about our journey, we've actually were asked to do this. HR was asked to do this by an engagement council that was formed here at LGH. That engagement council was looking at patient satisfaction scores, and trying to come up with ways to where they can be impacted. So one thing that they did was they asked HR and talent acquisition to be a part of that, and if there was a way that we could start to assess the new hires that we have coming in the door. And through that, we also wanted to reduce a lot of our turnover problems. So primarily, we wanted to reduce first year and 90-day turnover. We wanted to speed up the hiring process. And all of this, hopefully, would end up impacting the patient satisfaction scores that you'll see here in a little bit later.
Thanks, Kurt. I'll hand things off to Tanya, and Tanya, you can tell us a little bit about Health East and how you started your journey.
Awesome. Thank you, everybody. Super excited to be here. So just a little bit about Health East. We are about 7,500 big with 850 physicians. We have 4 hospitals and 14 clinics and have home care and medical transportation center as well. And we recently joined forces, as some of you may know, with Fairview Health Services, which adds to our repertoire 6 hospitals, 40 additional clinics, and we're really at 30,000-ish employees strong. So super exciting time for us to be integrating with Fairview, and just a lot of hard work in front of us, but a really good future for us, which is exciting. And so when I think about the goals and the genesis of where this all started, it's actually one of those things where it's hard to say it started here or we were asked about this. It was more a transformation of a lot of different things. And so that's why I think it's important to kind of call out. We had a relentless desire to move our culture in a better direction. So traditionally, we were bringing in folks that really were technically qualified for jobs, but we wanted to move the needle and bring in folks that were innovative, that were change agents, knowing that healthcare was transforming. And so how did our culture need to transform with what we were seeing outside of, our 4 walls? And so a big emphasis on how do we drive the right culture. In addition to that, a lot of heavy focus is being placed on, as I'm sure with a lot of you guys, is a lot of focus on that service orientation and patient focus. And so we knew it wasn't just enough to bring in a nurse or a front desk person that had the technical skills, but really what are those soft skills needed to be the best, to make people pick Health East over somewhere else. And so really a desire and focus on that patient experience. And so this is where some of the assessment work, we started thinking, how might we embed and pilot with some of these areas that we're working on other initiatives at the same time. In addition to that, as with other folks, I'm sure, is just always looking at how we can improve hiring efficiency. In addition, reducing turnover. In addition to that, one of the most exciting things that we did in parallel with this work is really upstream. We had an opportunity to roll out a cohesive organization-wide competency model. And so this kind of goes a little bit too with culture, is how do we set the stage around what we expect as a company and what good looks like? What are those key attributes that we want all leaders and employees to have, and roll those expectations out? And then subsequently, as we're selecting folks, how can we select folks that really embody some of those competencies and expectations that we're looking for? And then in addition to this one of our goals too was also to have an integrative approach. Lori will probably talk about this as well, but assessments is not enough, right? It's a holistic view of how to select that right person. And so we knew that this would give us an opportunity to look holistically at how to better our tools and to be more effective and efficient. And then, of course, legal defensibility is always important. It's sort of your point of entry is what I would say.
Good, perfect, Tanya, and really sets the stage for Lori now. And what she can do is talk a little bit about some basic foundational concepts about building a selection system. And what we mean by that is thinking about the entire hiring process, as Tanya said, holistically, coordinating all the components of the process into an overall talent strategy, thereby working to shift the talent curve and build the workforce you need. So Lori can give us some of those basics, and then we can talk more about the work done at Health East and at Lancaster General. Thanks, Lori.
All right, sure thing, Brian. Thank you. So ultimately, right, the primary purpose of developing that selection process, that selection system, is really simple. At its most basic, we want to take a larger number of candidates or applicants and whittle it down to fewer candidates or applicants, a qualified pool that we can draw from that's going to have the greatest likelihood of success. So sometimes for our positions, for really high volume positions, we have hundreds, maybe even thousands of applicants. Other times we struggle even to get a handful of candidates into that pipeline, but regardless, the purpose is the same, to put in a process that's going to help us in a reliable and valid way take that larger number of candidates and identify an individual or individuals that are going to have the greatest likelihood of success, right? So they're going to fit with our culture, with our positions, and with the organization. And the best way to do that is to design a well-coordinated selection process, right? We want to put the right tools in the right place, design a process that helps us to create a positive candidate experience, and ultimately that provides data to help hiring managers and recruiters make the best decisions possible.
And Lori, we'll talk about this, I'm sure, because it will come up, but the same principles apply even when you have a really small candidate pool, right? You just have to look at it a little differently.
Yep, exactly, absolutely. All right, so one of the goals of a selection process is really to help hiring managers and help recruiters focus their talent and attention on the individuals that have the greatest likelihood of success. So one of the hesitations that I typically hear from clients, those who are unfamiliar with that idea of having a structured selection process in place, is that they don't want tools to make decisions for them, right? So we constantly hear, you know, I'm a recruiter, I have 20 years of experience, I'm great at my job, and really that's probably true. But the truth is that when we design a well-structured selection process, the goals are twofold. One, we want to put that process in place that helps recruiters and helps hiring managers focus their attention on the individuals that have the greatest likelihood of success. So we want, in the situations where we have a larger candidate pool, maybe there is an automatic screen out of the people who have the least likelihood of being successful. And we really want our talent, our recruiters and our hiring managers to be able to focus their attention. And then we also want to provide them with really rich data that's going to help them make the best decisions possible, right? So by removing some of that subjectivity, we're providing hiring managers and recruiters the information and data that's going to help them make the best decisions possible. And if we do this kind of every step of the way, from application to hire, over time, we're going to make better decisions, better hires, and then we're really going to be able to move our organization forward in achieving its mission. When we're designing the selection process, we really want to do so in the context of broader organizational goals, right? So if we design a process that's maybe efficient, we're getting people in seats, we're filling those seats faster, but we're doing so in a way where maybe we're not hiring the right type of candidate, right? As Tanya mentioned, there's been a shift in healthcare, and we really want to focus our attention on hiring the individuals that are going to be more patient-focused, patient-centered, have that service orientation. And if we're filling seats faster, but we're filling them with the wrong type of people, then we're not doing what we need to do in order to move our organization forward closer to our mission, closer to our organizational goals. And ultimately, we know from the talent team's perspective that this isn't always easy, right? So we need to really focus on identifying what the behavioral competencies are that are going to be important now and also in the future. So we want to hire dependable individuals, those who are patient-focused, adaptable, innovative, and we want to also hire the individuals that have a greater likelihood of staying in the organization as well. Okay. So at Select International, when we partner with our clients, we spend a lot of time talking about program impact. There's a lot of ways that we can measure impact of the selection processes that we put in place. Some of them are easy, some of them are a little bit more difficult. Some of these metrics, we have a lot of organizational data readily at our fingertips. Some of them are a little bit harder to measure. But ultimately, when we're talking about program impact, we want to take a multifaceted approach. So there's no one way to identify the success of a selection program or the impact that it has. Some things like turnover, candidate experience, hiring manager satisfaction, these are the types of data that maybe are more readily available model in the organization, right? So when we're setting up a project, we want to talk about gathering that data to show the impact that we're having on these different metrics. Things like job performance. We love at Select International doing validation studies where we show the results or how the results of an assessment or of a structured interview relate to actual performance of individuals on the job. Ultimately, things like patient and customer satisfaction, quality of care, hiring efficiency, these are also goals. They're a little bit harder to quantify. And through the design of the process, of course, the ultimate goal is to identify that process that's going to support the organizational culture, support organizational success, and move you closer to your mission.
And obviously, Kurt and Tanya, you live this. The goal always is to show the organization the value that HR strategies are bringing. And one of the things I know Lori and her team see frequently are folks that plug in some of these tools, but then have a hard time showing that they're actually effective or understanding the effectiveness. So I know we take a somewhat unique approach there, Lori, right?
Yep, absolutely, Brian. So at the start of every project, and I know Tanya and Kurt will talk a little bit more about this too, but even from project kickoff, we love to sit down with our clients and outline what those goals are. So Kurt and Tanya just identified, hiring individuals with a greater patient-centered focus, having an impact on turnover, creating a really positive technological experience. Those were some of the things that they communicated to us at Select International were really important in terms of the success of the program. Like those were the things that they wanted to have an impact on. Right, and so from the very outset of our partnership, it's important to define those goals and then have conversations about the types of data that we're going to be able to collect to show impact on those goals and the appropriate steps in the process or the implementation timeline where it makes the most sense to gather that data to show that particular impact. So what we like to provide to our clients up front, within 3 to 6 months of implementation is an impact report. So at that specific time in the process, things like utility, right? So are we seeing the expected candidate volume? Do we have our pass rates and our fail rates on target? Are we getting enough people through the pipeline? That's something that we like to report out on it and show effectiveness. The candidate experience. Are they having a positive technology experience? Are they having a positive assessment experience? Do they like what they're going through? Do they find it to be job related? There's different types of data that we can gather to show this information back. And throughout the entire life cycle of our engagement and our partnership, we constantly want to be having these conversations, right? So this is the data that we might show 3 to 6 months in, perhaps a year after implementation. That's when we start showing the impact of the selection process on data like turnover and performance metrics. And I know Kurt and Tanya will talk a little bit about the specific impacts from their organizations as well. Right. This is one additional example of a validation study, right? So we talked a little bit about wanting to show the impact of an assessment or the selection process on actual performance on the job. So through a validation study, we look at actual assessment scores, so we can put current individuals or current employees through the assessment and then ask supervisors or managers to gather performance ratings. And we want to look at the statistical relationship between those two pieces of information. So this is an example from one of our validation studies that we've had the opportunity to conduct with one of our clients. We put over 900 nurses across different types of work environments, so inpatient, clinical, et cetera, through the assessment and then gathered supervisor ratings of performance. And we found that those individuals who would have passed the assessment, so who scored highest on the assessment, were 2 times more likely to be promoted than the individuals that scored poorly on the assessment. This particular example, too, was a really great example of a well-designed selection process. So there was an assessment and also some structured interviews for this particular client. So a year after we implemented the process, we took a look back at retention and found that the program actually increased nursing retention, decreasing turnover by 19%. Right? If we translate that into an actual hard cost, using some estimates, that's an approximate savings of $2.5 million after year 1.
And just to clarify, and we covered this in other webinars, but turnover is really complicated, and we're not proposing that the selection system is the solution for every turnover problem. And this organization was doing a lot to reduce turnover, but selection is obviously a big part of it. And then just the most recent validation study we did, it's interesting that if you look at the far right of this, one of the things we've looked at, to Lori's point, what we're looking at are correlations between data coming out of the selection system and on-the-job performance. And one of the things we've been talking about for a few years in healthcare, because we do it in other industries, is that these types of selection interventions can predict safety incidents. And this was exciting in that in this cohort, in this period of time for this validation study, including looking at work on-the-job performance and turnover, we were able to identify that the majority of the folks involved in a patient safety incident scored really low on the selection process, which means that's really useful data for us moving forward as we start to think about what are the behavioral attributes we're looking for, not just for patient satisfaction, but for patient safety. All right, let's talk about the actual competencies for a minute. And thank you, Lori, I appreciate that background. It's always important at this point to remind everyone what type of attributes we're talking about here, because certainly clinical and technical skills are always going to be the foundational elements of hiring in healthcare. But over the recent years, everyone has started to recognize that as we're looking at leaders, physicians, nurses, frontline staff, to a large degree, performance is driven by behavioral competencies. So this means we need to identify these in your organization for the roles in question, because we're looking for a different mix. So as an example, and we don't have time to get into this in great detail, but this is some of the work that Tanya talked about, is breaking down the organization into job families and starting to identify with a great deal of specificity what are the behavioral attributes you're looking for in a particular role and how they vary across the organization. In this organization, this example, emotional intelligence is important across all job families, but what we're looking for in an environmental services worker is different than what we're looking for in a manager, supervisor, or certainly in the C-suite. But you've got to do some of this work, and you've got to go beyond this to even start to define the very specific behavioral attributes that make up adaptability for a nurse. But that work really does need to be done. And I'll let Lori just describe this really quickly. This is just an example of a competency coverage grid, which starts to link competencies to some of those tools, right?
That's right, Brian. So essentially, when we're thinking about the selection process as a whole again, we want to identify the behavioral competencies and then make sure that we're measuring them at the appropriate places in the selection process, and that we're measuring the more important competencies multiple times. So you'll see here in this example, there's an assessment, and then there's also 3 interviews: a phone screen, a peer interview, and a hiring manager interview guide. So something like motivational fit, super important, predictive of turnover, it's measured in all of those areas, whereas something like continuous improvement, an important competency, but maybe not as important as some of the other behavioral competencies, and so we're measuring it in that last hiring manager interview. And we want to think about the selection processes just by level, right? So Brian mentioned with the competency grid before that the competencies vary by level, but also the process as a whole. So depending on the types of positions that we're hiring for, the candidate volume, the level of that role, the selection process itself might differ. So in this example, we see level 1 and level 3, the nursing, we have a screening assessment up front, there's maybe a phone screen and then a hiring manager interview, whereas to the far right for the director level, the process looks very different. We're going to source some candidates, maybe we'll put them through a really robust assessment and interview process, and then make a decision from there.
Good, thanks, Lori. And I'm actually going to jump ahead just in the interest of time and get to Kurt. And Lori talked about all the metrics that you should be evaluating when it comes to a selection system. So what I want to do now is hand things over to Kurt, and he can tell us a little bit about some of the metrics they've been following and monitoring as they've implemented this program.
Sure. So obviously one of the ones that we talked about first was turnover. And this is one of those things where we implemented in August of 2014. And whenever I say implemented, we started to use the assessments with positions that were posted that day going forward. So it took us a little bit of time to actually exclusively hire through the assessment process. So you'll see from that first light blue line up until the first red line, we were getting up to speed with the assessment and starting to use it exclusively. Once we hit that mark, and then we had enough people go through that we've hired and then would have been here for 90 days, you can start to see the results, and you can start to see how 90-day turned over for us, and that was actually a reduction of about 13%. And then first-year turnover did the same thing. It fell about 37%. It went from 7.3% to 4.6%. So we did see some pretty good results from the assessment. And then along those lines too, whenever we looked at time to fill, we saw a pretty decent decrease in the amount of time it took us to fill positions. A lot of this is not just because of the assessment, but it's a big part of it, mainly because we're finding kind of the cream of the crop a lot faster. We're not sending as many candidates to managers. We're getting them more focused in on higher quality candidates, which means they would have less interviews to do, which then means the process gets a lot faster. So these are some of the results that we saw as far as time to fill is concerned. And then, of course, the big one, the patient satisfaction. I think the slide pretty much tells the story exactly of what we saw. And since then, it's also continued to climb up and up. You know, a lot of this, when you think about turnover, you think of time to fill. Units, areas aren't getting taxed as much. We're not having to go into overtime as much. We're not having to rely on temporary agencies coming in. So overall, not only is the culture getting better, but the departments aren't seeing as much of a lapse whenever they do have vacancies.
Great, thanks, Kurt. And I think this reflects again that idea of what are all of the metrics that we're trying to evaluate. And before I let Tanya show some of the results there, I wanted to answer one question, a couple questions, because we keep talking about assessments, and we're not going to really get into the details of what the tools look like. But just so people can picture these, someone asked, how does a candidate actually complete the assessment? The tools that Tanya and Kurt are using and that Lori is discussing, these are online tools. They're very simple. Frequently, they're integrated with the applicant tracking system. They can be taken on a computer, on a phone, on a tablet. They're pretty seamless and easy to complete. And the other question was, are we talking about one assessment or multiple? We take the approach that we want a great deal of specificity. So these are very much healthcare-specific tools. An environmental services worker is probably taking a tool from us called Service Fit for Healthcare. That's that service orientation tool. Nursing is taking a nursing-specific tool. That's the approach that we take. That's what we build. We are not big on using one type of assessment, let's say the Myers-Briggs or some other tool like that, across. These are tools very much built specifically for hiring and for particular roles. Okay, Tanya, I wanted to get to you and talk about some of the things that you're seeing coming out of the program.
Yeah, so Lori showed you the slide, the Health East Impact Report, and the numbers are obviously wonderful, and we could talk through these, but I thought I would take it up a notch just to talk about how we really use this impact report. I feel like this was my change management tool. So how we use this is a few months into our pilot, Lori and team helped come up with essentially this data. So again, looking at satisfaction by way of the candidates, satisfaction from a hiring manager, how are people using the tools, are we completing the assessments by process, on process, I should say, and things like that. So you can kind of get a flavor for the types of data, all positive. But what was great is a few months into this, we used this to really affirm what we had sold on the front end of the project. We know what the value of assessments can be, and here was the proof. And so this really acted as a good validation with our leaders to say that the assessment is doing exactly what we want it to do. We are trimming out people on the front end on the service fit or the customer service side. They're failing the assessment, and those that are passing are getting through the process, and we're getting better candidates. In addition, we're seeing that manager satisfaction is going up. Our candidates are saying that they're having a good experience. They like sharing with us their experience and their job skills and things like that. And so this was a great change management tool to really show those people that wanted proof and wanted data, to really show them that the assessment was making a difference, and we were working towards meeting some of those goals that we had set for our overall approach.
And Tanya, I mean, those concerns are legitimate, right? If you go to the organization and say, we think we can put some tools in place that will target people with a certain behavioral profile, let's say, or more inclined to be patient-focused, the reaction you get is, that sounds great, but is that gonna narrow my candidate pool? What's the candidate experience? Am I going to be able to fill slots, right? That's the concern that you get.
Yeah, we even get that sometimes in recruiting, where they're like, I'm getting far less candidates because this assessment is pushing too many candidates out. And it's like, well, let's look at the data. And the data says otherwise, that actually we're pushing out exactly how many we intended to push out and that you're getting the best candidates. So even internally within your HR team, who's typically more open to this, I still think that they're sometimes caught up in the day-to-day, and so stepping back and looking at the metrics and how far you've come and what your results are super important to keep that momentum, because I think folks that are in the weeds of it every day could base their opinions based on a recent situation versus kind of that bigger picture and what we're trying to solve for as a system.
Which gets to the title of the discussion here, is evidence-based hiring, right? And we found, particularly with nurses, they react positively to this concept, that we're going to look at the data and we're going to make sound decisions based on data, looking at large data sets, and not work on intuition, because we wouldn't do that with patients, so we're not going to do it in the hiring process.
And to Tanya's point, I think constantly showing that data back to the organization is really important, just to keep people along on the journey.
And Tanya, did you mention time to fill?
No, I didn't. So pivoting to that,
okay,
right, is getting a little bit more granular, is we wanted to look at reducing the time to fill, not only from an efficiency in-house, but that really does correlate as well with candidate experience and things like that. We were losing candidates that we were taking too long. They were going somewhere else. So this visual is just a depiction of, you can see we went from 45 days to 33. And similar to Kurt, of course there were other efforts going on, so the assessment isn't the only thing, but some really dramatic results. It's doing what we intended. We're kind of pushing those candidates that we feel are the best up to the top. We're interviewing them quickly and moving them along the process. And then I think that next...
There we go.
Oh, go ahead.
Yep. No, I was going to say, and I think the next slide talks about those interviews, yeah.
Yep, and then this next slide really is a summation of, before we started, we were at an average about 3.25, and this shows our reduction to about 2.65, which again is that efficiency piece that helps.
And that interviewing piece is interesting. Other industries have solved some of this in the past, but it's not uncommon for us to talk to a hospital where a nurse hiring manager expects to see all the resumes and interview 15 people and then make a decision. And what you're hearing here is a process whereby there are tools and systems in place to send to them a smaller number of really qualified candidates. Now, and then we're not going to spend time talking about this, but I did want to just mention, some people asked about the different types of tools. This is how we look at it. This is one snapshot of our suite of tools. What we have are select assessment for executives. So if you come to us and say, I've got 2 candidates for a CNO position, we would use our executive assessment process. We're doing a lot more work in the area of physician assessment, both for selection and development. So we have a short physician tool for the hiring process and a longer one for looking at physician leaders for selection and development. For managers and directors, we have a healthcare-specific leadership assessment. We have a nursing-specific tool. We have a slightly longer nursing tool that we use for development. Then we have service fit for healthcare, allied health fit, covering essentially all the various job families. A lot of similarities in the tools, but differences in regard to face validity, difference in regard to how the information is fed back. And one of the interesting things about healthcare is the organizations are so complex that we end up pulling from our sales suite, or we've got health systems that have call centers. So again, trying to bring some very job role specific tools to the situation. All right, we have lots of questions, so I'm going to jump into these now, and I think the timing's perfect. We have about 25 minutes. One of the first questions that came up was specifically with regard to those behavioral competencies and that progression map that we showed. How do you decide what's most important? How do you decide what you should measure, Lori?
Yeah, one of the approaches that we typically take is called a job analysis, right? The purpose of a job analysis is to find out more about the jobs. And you can do that through multiple types of data collection efforts. So a lot of times we'll conduct focus groups with high-performing individuals in the roles or supervisors or managers of those positions and ask them questions like, what do individuals do in this position? What, from your perspective, are the behavioral competencies that are important to success? What separates high performers from everyone else? What separates low performers from everyone else? And through those conversations, we'll hear constant themes in terms of the behavioral competencies. And then we can supplement that information. Maybe we're having visionary or leadership conversations, making sure that the competencies that we're identifying right now that are important to success will also be important to success for the organizations in the future. We can also distribute a survey, gathering some quantitative data on these competencies, but it's really through those conversations and that data collection that we identify that initial list of competencies that we think are important to measure in the selection process.
And that methodology varies based on the situation, right?
Exactly. Who's available, the time commitment, all of those variables kind of are considered when deciding the best approach.
I know we've had clients who have historically potentially had OFCCP issues, and they want a more robust data pool to build that because of the legal defensibility issues. And we would encourage anyone, if you're doing this work, building a selection system, make sure you're working with an organization that really understands all those legal defensibility pieces that Tanya alluded to earlier. A well-designed selection system and well-designed assessments implemented well will enhance legal defensibility, but certainly if you don't attend to those, you could create problems.
Yeah, and then another reason to collect data, not only to identify what's important, but it's also part of the change management experience, right? So we want to be having conversations with hiring managers or those who are going to be implementing the process, getting their perspective on what's important to these roles, so that when we implement the process, we can tie it back and say, hey, we asked you what was important, we heard you, we're measuring it in this way. And so it's a really nice way to tie into the change management experience as well.
I have a question that I could probably put to Tanya and Kurt, because I think it really is a nice practical question, and I don't think we addressed it here, but you both talked about reducing time to fill. What is your experience, and I'll start with Tanya, in trying to tie some dollars to reducing time to fill? How do you do that? I mean, I know how we do it for turnover. Organizations all do it a little differently, but there's some pretty straightforward ways to calculate that out there. What about time to fill? How would you actually go about demonstrating the cost savings, Tanya, and then maybe Kurt?
I don't know, Kurt, if you want to grab this one, just coming from talent acquisition. Really, our talent acquisition side has, now that it's part of Run State, they've really done that, and I haven't gotten involved into what that means, but it's substantial what we're seeing to the bottom line, certainly.
Sure. So one of the ways that we look at calculating that is we actually know, we have somewhat of a formula, and I think every organization kind of looks at this a little different as far as kind of a vacancy rate, or if a position turns over, we know how long and how much that has cost us. And then basically what we do is if we can reduce how long it takes for us to fill that vacancy, and the reduction that happens, we can show the cost savings to it. Again, I think it's different for everybody, and I think it's a matter of how you interpret that first, and then see what the results are as far as whenever you do reduce time to fill, what that cost savings is. I know some organizations use temporaries or travelers a lot more than other agencies or organizations do, and I think that's a big proponent right there. But certainly there are a lot of other things that go into it, like advertising, the amount of managers' time involved, the amount of recruiters' time involved. So it really depends on the organization.
Thank you, Kurt. And obviously we're not going to get to all of these questions, so what we're doing is we're tracking them. We will work in the ones right now that seem probably most interesting to the large group. Anything else we get, we'll respond to afterwards. But a question came up. We've mentioned legal defensibility a couple times. So two things. I would say when we talk about legal defensibility, what we're talking about is putting a system in place that reduces the likelihood of a challenge to a hiring decision, right, Lori? Mm-hmm. And if you are challenged, you've got lots of documentation and evidence and objective data that shows this was an appropriate decision. And the question came up, what about disparate impact? So how do these tools relate to the concept of disparate impact?
Mm-hmm. Yeah, so disparate impact, it's something that we'd always recommend monitoring, right? But avoiding. It's not illegal, but we definitely want to avoid it because we know that diversity and inclusion is really important. So when we're designing the selection process, that's always something that's in the back of our mind when we're making decisions about how to set up the process itself. So for example, when deciding what tools to use, we know that assessments that focus on behavioral competencies have less likelihood of disparate impact than something like a cognitive ability test. So that's why a lot of our fit assessments that we place high in the selection funnel, where we see a lot of candidate volume, are more personality-based. There's some situational judgment questions, and they're focused on behavioral competencies, because that's one way that we can mitigate disparate impact. It's something that post-implementation, we also want to make sure that we're monitoring, and if we see something trending in a direction that it shouldn't be, we can take steps to address that. So it might require a tweak to the scoring profile to decrease the potential for disparate impact, or maybe, if it's actually job related, then perhaps we do a validation study, and that's additional evidence that we can show that the decisions that we're making are job relevant and based on business necessity. So it's always something that's in the back of our mind and something that we're constantly monitoring.
And if you're using the right type of tool, there will be documentation and evidence that when that tool was built and designed, there were studies done to show that it didn't create adverse impact or disparate impact. And is it safe to say, Lori, that generally personality-based testing doesn't tend to create adverse impact?
A lot less likely, yes, that's correct.
A lot less likely. So again, any hiring decision you're going to make has that potential. What we're trying to do is add as much objectivity to it as possible. Sometimes it's just a matter of improving the interview process to make that more objective and consistent and create more documentation so that you're avoiding some issues if you ever are challenged, because you will be challenged. That's what we found. That's just the nature of things. Another question came up. Well, this is a very practical question, so I'll ask Kurt, and maybe Tanya has some thoughts too. Some folks asked about applicant tracking systems, and there are basically two questions. How do these assessments work with the applicant tracking system? And do you have any general thoughts on what to look for in an applicant tracking system? Because some of our attendees actually don't have one but are considering them. So twofold questions, Kurt. How do the assessments work with the applicant tracking system? And if you have some basic advice on what to look for with an applicant tracking system, that'd be great.
Sure. So in my experience here at LGH, we actually have had two different applicant tracking systems that we've used. We started out with an older system that was basically just an applicant tracking system that fed into a more core HR system. How we used it is that there would be a feed that would go, well, let me back up. The recruiter would first look at candidates that would apply, make sure that they're qualified for the position, then we'd queue them up for the assessment. There would be a feed that would happen to Select, and then we would get the results from the Select system and send those along to the managers. Our newer system, though, is a little bit more robust. It actually is not only the applicant tracking system, but basically everything else within HR. So how we have it integrated with Select is that, again, the recruiters go in, they look to see if somebody's qualified for the position, they queue them up for the assessment. Every 2 hours, the integration occurs to where we pass information over to Select. Then it's a two-way integration, so that information also comes back from Select, loads into the candidates' profiles, so the recruiters can then see how the assessment results are looking. And then we send those along to the managers. The manager has one big snapshot of not only the person's resume, demographic information, but also the assessment results. And that's basically how it works. And it's a pretty nice process. We're not waiting very long for results. Select does a great job of keeping track of those assessments of people that have passed. Those results are good for a long period of time. We don't have to track it on our end. We just keep feeding people into the assessment and let them take care of tracking who's passed, who has not, and then giving us those results back. So it's worked very well.
Thanks, Kurt. And Tanya, I know you have some experience, I think, switching systems recently.
Yeah, and I would say it mirrors a lot of what Kurt talked about too, really a seamless process where we get real-time information, and it's been very smooth. Mm-hmm.
Good. And of course, choosing an applicant tracking system, we have some that we like. We found that most clients have some dissatisfaction with whatever system they're using because no system is perfect. I can say in healthcare, one of the things that's fortunate for us is most health systems actually have a pretty robust applicant tracking system. We don't see many systems anymore that aren't using them. I think one of the challenges, smaller organizations finding an ATS that might work for them at the right price point, that becomes a problem. I had an interesting question, and I'm going to pose this to Lori. We frequently hear the idea that we want to hire for people who fit our culture, which is sort of a vague concept, culture fit. And the question came across is there a question from our assessment that evaluates culture fit? And I don't know that there is a question that maps culture fit. I know when we talk about culture fit, we tend to think about drilling down and saying, no, what are the very specific competencies you want to build the culture that you have in mind? There is no question that gets at culture fit, right?
Right, that's right, Brian. And so when we're talking with our clients, and I'm sure Tanya, I think you can probably speak to this as well, we'll have them define culture and what that specific culture means. So for example, we want a patient-focused culture, and so we tie that back to the behavioral competencies that we're measuring in the assessment. Another way to get at culture fit that I really like, at Select International in our interviewing program, we talk a lot about the idea of motivational fit. So is the candidate going to fit with the specific position and with a specific organization? And I really think that the interview is a great time for hiring managers or recruiters to describe the culture. So to provide some specifics to the candidate and then gather some information, from the candidate about whether or not, those ideas and aspects are satisfying to them. So I'd say both from the assessment, the competency perspective, and then from the interview, asking some specific questions and describing the culture are kind of two good ways to get at that.
And when you look at a behavioral assessment or personality assessment, I like to tell people that any single question predicts nothing, right? It's a group of questions. Now, there are certain questions that can give you a sense of what they predict. So if you ask the question, how many jobs have you had over the past year? Or you ask, how many unexcused absences do you believe are acceptable? Those questions do tie directly to things like dependability and turnover, but you don't draw any huge conclusions from a single question.
Yeah, there are no right or wrong answers to those questions, but rather they indicate how dependable or how adaptable, a particular candidate is. And that information, of course, is combined with other items, different item types, to come up with that overall competency score.
The next question is, again, really practical, and it's going to change by organization. So I'm going to ask Tanya and Kurt to give their thoughts on it, and then we'll give you sort of some background there. But how long does it take to implement something like this is the question. And obviously that depends on the organization. But Kurt and Tanya, what was sort of the rollout time from concept to go live for you guys? Tanya, you can go first because we've been calling on Kurt first every time.
Yeah, so I came in newer to the organization, so I know a little bit of work had been done, but I would say about 6 months-ish. It depends. We started off with a pilot, so we didn't just flip the switch, right? We said we want to look at a certain group of people and pilot it for the next 90 days. And that was really helpful for us because we could bring the organization along and we could show data for that subset of the larger population before that we were all in. So bringing people along, your HR team, your talent acquisition team, your talent management team along. And so I would say about a good 6 months to get going, because part of it too is, and I think, Kurt, you were alluding to this with some of your graphs, some of it is getting people on process. It's a new way of doing things, and you got to have it under your belt for a couple months before the process is done very efficiently and effectively each time. And so I would say about 6-ish months before we started really feeling a nice groove. Now with that, after about 3 months, we started checking the data and getting impact reporting and things like that.
Yeah, I'd say for us it was probably 4 to 5 months to get it underway. But again, like we were talking about before, one of the things that we really wanted to see was how this would affect first year turnover for somebody. So keep in mind that you have to get this up and running. You have to assess somebody, you have to hire them, and then they have to be here for a year before you can gather the results. So I think sometimes with a matter of what you're looking for as far as ROI, depending on what you're measuring and what you're wanting to get out of it, it might take some time before you can get enough of a sample size to show what that impact was before you can really come back and see it. But just to get it off the ground didn't take very long at all.
Yep.
Yeah, one of the good things about Lori's team working specifically in healthcare and understanding health systems is we've fine-tuned a lot of these processes. So mapping the process, defining the competencies, gathering the data, configuring the assessments. We frequently can do all the work on our end, even for a pretty large system, in a matter of 3 months and flip the switch. Now, to Tanya's point, you've got to do some work on the front end to position this thing for success. So that might take a little longer. But the key is that it's just a very thoughtful rollout.
Yeah, from a technology perspective, I think it's very, very, very easy. But from an actual implementation and change management perspective, that's where we want to invest time, and that's where we want you to invest time as well, because that'll ultimately lead to success.
All right, we have a great question that goes right. Go ahead, Tanya. I'm sorry.
Just going to say the other thing that we did, people started getting more curious about how to select the right candidate. And so in addition to looking at assessments, we took a holistic view of the interview guides we were looking at, interview training, tools and resources. And so we approached it holistically as well, which I think helped with buy-in, skill development. And we could really, I think, reinforce the concept that assessment is one data point in the holistic process of picking that right candidate. And so that took a little bit of time, but I think that time on the front end has yielded a lot of dividends. I mean, our classes are maxed out when it comes to interview training. People want to learn how to pick the right candidate, and we reinforce the assessment component as well in that training.
That's fantastic.
We're going to run out of time here shortly. I want to make one comment, and then there's a great question that I think would be perfect to wrap up with. I've gotten several questions about physician assessment, and that's an area that Lori and I do a lot of work in. I can tell you we have a handful of large health systems that are using our physician-specific assessments for development and training, certainly, and we're seeing more that are integrating an assessment into the hiring process. Psychometric principles are the same. Positioning is different, as you can imagine. So we've got some information that I'll share with people that were asking about that. But we made a comment early on about something, and this is a perfect, and I've got 3 or 4 questions in a row about it. In such a tight job market, how do you balance the desire to get the perfect candidate with what's realistically available? And what do you do when you don't have a candidate pool? And I'm going to ask Lori. Okay, Lori just pointed to, she wants to hear what Kurt and Tanya have to say first. Now, both of you I know work in markets where, at least in certain regions of your system, it's a challenge to get qualified candidates. Kurt, how do you balance that idea of finding the right people with, hey, we need people to provide the service?
Yeah, I think some of it has to do with just the type of position that it is. Obviously, if we get very specialized, we might take a different approach with the assessment to where it's not maybe a pass or fail sort of thing. It's just one piece to the puzzle that we'll keep in mind as we go through the entire selection process. I think one of the bigger things that we always consider is what would be the impact of if we made a not so great hire in this area? Would that hurt us more than just getting a body in here to do the job?
Tanya, any thoughts on that idea, on that concept, and how you overcome? I'm sure there was concern.
Yeah, it was that last statement. It's better to get weighted out and get that right person, because you're going to regret it financially as well as what it does to your culture and other things. So finding that good candidate, I always tell people, if you're not super excited to bring that person in, they're probably not the right person.
Yeah, and I think that's a story that we hear time and time again when exceptions are made, right? That our clients end up regretting them for those very reasons. And one additional point, I think when you make a hire like that, because there may be some times when you can't stick to your guns in terms of what you know is right. Maybe there's organizational pressure from someplace else. A lot of Select International's reports also have development reports that are available. So if you do hire somebody that maybe has some red flag areas that you're aware of, there's at least that information so that when they come on board, you can help set them up for success and kind of develop an immediate onboarding and development plan for them.
And I think it also goes to the idea of understanding the selection system as opposed to just plugging in a test.
Yep.
because that allows you some flexibility. Lori and I we've worked on 3 hospital startup projects, and most systems don't get the experience of building a new hospital. But in manufacturing, it happens relatively frequently, so our team's really good at it. And one of the things they learned quickly is the hospital might project a certain candidate pool from a market, hoping they'll have a robust candidate pool, but when they don't, you've got to adjust quickly, make some decisions, remain as objective as possible, remain as consistent as possible, but you've got regulatory requirements. You have to have certain staffing ratios in some parts of the world, or again, you have to have the body to provide the service. So you just have to be pretty thoughtful, and you better make a really good hiring decision the first time, because if it's wrong, you're going to be starting over with another really slim candidate pool. We have time for one more question, and then we'll wrap it up. And again, we'll respond to everyone that submitted questions. Lori and I will sit down and craft responses and send you all emails. The last question I wanted to plug in, though, was what about union-based facilities? Yes, we've used assessments in those settings. And of course, in other industries, it happens all the time. We actually have a couple of health systems where a hospital or a few hospitals are non-union and others are. And so there's some work that has to be done on the front end, but if you communicate, and I was going to say if you have a good relationship with your organizing body, that helps. But generally speaking, you're putting in tools to hire the best person. And we found that the union is in favor of that as well. But again, it needs to be communicated clearly on the front end so they understand what's going on. And you've got to work around some things, but it works. It's certainly not a barrier to putting in quote-unquote evidence-based hiring systems. I didn't know, Laura, if you had any thoughts there as well.
That was a good summary, Brian.
Thank you. Well, we will wrap on a good summary, because I don't get that from Lori too often. We appreciate everyone's attention today. We hope that was a useful discussion. Thank you to Tanya and Kurt. You guys were great. Obviously, we love working with you. We want to thank the folks at Becker's. They do a wonderful job putting on these events, and we love participating in them. And as I said, we will get out to anybody responses to the questions that you submitted. We have a long list, so we're excited to get to those. And if you have further questions, obviously come to our website. My email address is here, and you can reach out to me directly, and we can make Lori available too, or anybody else on our team. So thanks, everybody. We appreciate it. I'll hand things back to you, Emma, to wrap it up.
Thank you so much for that great presentation and discussion. That concludes today's webinar, and we hope to see you join us for future events.